My name's Lucy Whiteman. I'm a Lymphoma Clinical Nurse Specialist at the Royal Masrden Hospital in London. So scans and results of biopsies always take a little bit of time to get the results. They need to be looked at by a specialist who specialises in lymphoma so that we are clear on the diagnosis, and also any scans that you have for checkups or follow-ups or during treatment, they also need to be analysed by a specialist radiologist to make sure that we compare them with previous scans and we get the accurate result for you. The person who's actually taking the scan is not able to give the results or read the results. The scans need to be looked at by a specialist radiologist who will then write a report. So the results will take a day or two, and usually we need to discuss this in a multidisciplinary meeting so we can look at the tissue and the scans together and come up with a plan, a diagnosis, and then a plan of the best treatment. If we get a result quickly, it doesn't mean that that's bad news, or if it takes a long time, it doesn't mean that it's necessarily bad news. It just means that we need more information and more time to look at some results than others. If we feel that things are getting worse and you're more symptomatic, then we will start the treatment sooner if we need to. So it's very important that you get in touch with your key worker or your clinical team at your hospital if you feel that your symptoms are getting worse. Obviously, if we feel that we would jeopardise anything by not treating you sooner, then we would start treatment sooner. But it is important to wait for these results if at all possible. Sometimes you will be asked to come back for a repeat of the scan or a different type of scan if we haven't got all of the information we needed the first time, or if we need another type of scan to give us more clearer information. And also sometimes people do need to have another biopsy if they've taken one piece of tissue and it's not quite a good enough sample, it's not a big enough sample. This does happen, and it is quite normal for that to happen because they want to get the best information that we can about the type of lymphoma that you have. You'll then be asked to come along usually to a clinic, and you'll see a doctor and often a clinical nurse specialist, and we'll talk through with you the results and what they mean. It's very important that that's done in a face-to-face situation so that you can ask questions and we can explain clearly all of the results. It's often helpful to bring somebody with you because it's quite a lot of information to take in just for one person. These results are not given over the phone. That's not a good idea to deliver that information over the phone. It's very important that we see the patient face to face and explain what this means and what the plan is. The hospital that you're being treated at, the key worker, the nurse specialist, or one of the medical team should be able to give you an idea when they book the tests for you when you're likely to get the results. And usually they'll book you into clinic in a matter of a few weeks or less, depending on when they think the results will be available. If you have any questions about that, you should always contact them to ask.